The procedure that I'm getting is a laparoscopic hysterectomy. I decided that this was the right time in my life because I'm in my 40s. I have dealt with issues for years. I have had heavy bleeding for years from the time I was a teenager. I was put on birth control at a fairly early age because of heavy bleeding and the length of duration of the actual cycle itself. And I had a lot of pain associated with my cycle. And so I was put on birth control, and I stayed on birth control until I was ready to have kids. And at that time when I was ready to have kids, it's like my problem started all over again. And now that I feel like I'm finished having children and my issues are back to exactly where they were, I felt like this was the right time.
Today we did a laparoscopic assisted vaginal hysterectomy. This is my typical way of doing hysterectomies. It allows for a fairly rapid recovery. They go home frequently the same day. Some can spend the night. It just depends on how they're doing.
I was really surprised that when Dr. Kaufman told me that I would be able to go home the same day after having the hysterectomy. The only other person that I knew of that had had a hysterectomy was my mom over 20 years ago, and she stayed in the hospital for a week.
There are multiple ways of doing hysterectomies, including open hysterectomies versus robotic and even vaginal. If you have a large incision with an open hysterectomy, that takes weeks to months to get over that. Whereas the small 5mm port sites that I use, I would say that most patients won't even feel those incisions. Women vary dramatically in their desire or need for hysterectomy. Some of them have put up with bleeding or pain for so long that they're ready to go when they come see me in the office, and they want to know if they can do it in a week. And some women are not nearly along that frame of thinking and are worried about the consequences of it. If you leave the ovaries, you won't lose your hormones that you make yourself, and so that typically means that you don't have to have hormone replacement and that you won't notice a large difference, except that you won't be bleeding, you won't have pain. So letting them know that they won't need to take hormones if we leave an ovary, that's pretty comforting in the idea that now I don't have to have hot flashes and night sweats and worry about my postmenopausal complaints.
It's way better than what I thought. I don't feel any worse now than I did when I woke up from surgery, which is not typical. Typically you have more pain involved as the day progresses and the local wears off. So I took some ibuprofen, and then she said, "Do you want to take a pain pill on your way home, to go home with?" And I was like, I guess. But I'm fine, so I can go home.
Well, from the moment I met Dr. Kaufman, I felt very comfortable with him. He makes you feel comfortable. He answers every question and then some that you have. He wants you to feel comfortable with the decision that you're making. He wants to make sure that this is the right time in your life, and what symptoms are you having, and is this the right choice for you? He has a wonderful bedside manner. Really cares about you as an individual, not just as a patient. And I feel great. I had to remind myself that I had just had surgery and that I should take it easy because I felt really, really great. It's just a huge kind of weight lifted off to not have to worry about, okay, here in a couple weeks I'm gonna have extreme bleeding, I'm gonna have a lot of pain. I would tell women who are reluctant to even go see, Dr. Kaufman about getting a hysterectomy. I think that if you're afraid, you just have to talk to Dr. Kaufman. I think he will put your mind at ease. I was just impressed with everything. His bedside manner, the surgery, how well I healed, how little discomfort I was in. Now I have more energy. I just feel like I have so much more to give than I did before.